Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Hey there, Amarillo. Good morning, and good morning to everyone else around the Texas Panhandle that's listening in this morning. Thank you for joining us again today for yet another episode of A Snowball's Chance in Healthcare. My name is Josh Butler. I am the president of Butler Benefits and Consulting. We are a brokerage firm and consulting firm here in Amarillo, Texas. And I'm also the host of this here program, A Snowball's Chance in Healthcare, where each week we're dialing in on topics related to healthcare and employee benefits so that people can access a more transparent and more affordable healthcare in communities all across the country. My mission at Butler Benefits and on this program is to share valuable information to businesses who sponsor health insurance plans for their employees, as well as provide a lot of value for individuals and families all over the country and give people help to lower healthcare costs or make quality improvements to their benefit plans, or to even improve the quality of their own personal health as well. And so very passionate about that. And we're going to talk about an interesting topic today, but I'm going to start with something that a colleague of mine once said. It's been several years since she said that, but she once said that, you know, people really don't need to know, they don't need to be educated on how their health insurance works, right? I mean, and if you think about that, she's right. I mean, most people already know how their health insurance works. They know how their deductible works. They know how their co-pays work, and they already know how all that works. But she said, what people really need to know, they don't need to know how their insurance works. They need to know how to work their insurance. And that's a completely different statement, you know, and today we're going to talk about that, and she's so right. When I visit with people, they don't want to discuss co-pays. They don't want to discuss, you know, how deductibles work and co-insurance works. They get all of that. And don't get me wrong, there is a time and a place to have that conversation and to deliver that sort of education. But most of the time, people have a good sense of how their insurance works already. But what a lot of people don't know is how to work their insurance, and we're going to talk a little bit about that today. And today we're gonna discuss a topic and an issue that, listen, if I've dealt with this once in my career, I've probably dealt with this a dozen times in my career. And frankly, I'm surprised that this issue still comes up today, and you'll see why here in a few minutes, but it does, and it comes up more frequently than you would think. But today's topic and today's discussion, I'm just going to pose a question, and here's the question. Can I opt out of using my health insurance at a doctor's office or a hospital or a pharmacy and pay cash instead of using my health insurance? Do I have the right to not use my health insurance, right? That question comes up a lot, and you'd be surprised that not everybody knows the answer to that question. But today, right here on episode 16 of A Snowball's Chance in Healthcare, we're going to settle that question for everybody. So listen in, and we're going to get started. A couple of weeks ago, I had a client call me up, and they reached out, and she said that she had gone to a hospital for some testing, and she ended up having a minor procedure. And while she was there, when it was all said and done, she had inquired with the hospital about what the cash price would be. Could I just pay you cash? She was prepared to write a check and just pay cash. And the hospital told her that because she was covered under a commercial health insurance policy, that paying cash was not an option. They even went further and said that it would be considered, quote unquote, insurance fraud. Insurance fraud, ladies and gentlemen, if the hospital did not submit her bill and her claim to her insurance company. Okay, now that's one example. I had another client call me one time, and that he was kind of upset. He had been to see his heart doctor. It was a specialist visit, and he asked the billing people, when he wrapped up, he said, "What is your cash pay rate?" And they gave him a price. It was $200. And they said, "But you can't pay that because we see that you have insurance on file." And he said, "Well, what does it cost me through my insurance?" And they came back to him, and I guess the girl came and did her figures, or called the insurance company on what his portion of the deductible he would owe, because he was on a high deductible health plan. She came back and said it was $970, a difference of $770. $970 through insurance, $200 cash. And that doctor's office told him something very similar, that because he had health insurance, that that the doctor's office was required to file a claim, and that he could not opt to pay cash. Now, first and foremost, I know this is very, very counterintuitive to a lot of people. How can it be that healthcare costs more without or with your insurance than it does without using your insurance, right? The whole premise of insurance is typically to make things more affordable, right? And in a lot of cases, that's true. It is cheaper to use your insurance, but if anybody's ever, tons of people have run across this issue, and we simply know that in healthcare, oftentimes, this simply isn't the case. More and more people are starting to realize that cash rates are better than the rates that they would pay by using their health insurance. And like I said, that may be counterintuitive to a lot of people, but that's simply the case. And it's because of this. It's for this reason that when we go and we educate our clients and we educate employees at our client companies, we always tell their people that it is an extremely prudent question to ask when you receive any type of healthcare service. Doesn't matter if it's a specialist visit or a primary care visit or a surgery or a hospital stay, or you're at the lab or you're at the pharmacy. It is a prudent question to always ask this question. What is your cash price? Okay? What's your cash price? So let's get back to the original question. Can a person opt to pay cash instead of using their health insurance? And the short answer is yes. Of course they can. Of course they can. But you know us, we're not going to stop at just a simple yes. We're going to arm you with resources and information, and we're going to explain why. Because we don't want people to be misled. We don't want people to be misinformed. All of this ties back into your personal health information, your PHI. You're going to hear me mention PHI a few times in today's episode, but your personal health information is protected under a federal regulation called HIPAA. Everybody understands what HIPAA is. It's about privacy rules and things of that nature. But the HIPAA privacy rule has always provided patients the right to request special and confidential treatment of their protected health information. Like people like me that deal in PHI and with people's PHI, we are bound by strict standards on how we can use your personal health information, and so are doctors and hospitals. But in the past, that right has not always been an absolute right. In the past, covered entities like hospitals or doctors' offices, they were not required to 100% honor special requests made by patients in the way that they handled PHI. Especially in the past, they were not allowed to, they just said, we can send your PHI to an insurance company so we can get paid. And there were no ifs, ands, or buts about that. But everything changed in 2013 when the federal government passed an act. It is a federal law called HIPAA HITECH. Remember those two words, HIPAA HITECH. It is the HIPAA HITECH Act of 2013. Man, that's kind of hard to say. HIPAA HITECH Act of 2013. And now, under this new provision, if a patient requests that their PHI, their personal health information, not be sent to their insurance company, the doctors and the hospitals or whoever the healthcare provider is, they must honor that request, and they must agree with the patient not to send PHI to their insurance company. So simply put, if a patient chooses to pay cash instead of use their health insurance, and they request that the provider not submit their claim to their insurance company, The HIPAA HITECH Act ensures that for patients. Okay? Now, for those of you that want to write this down, HIPAA HITECH, the specific provision within HIPAA HITECH that grants these protections and these rights, you can write this down. It's located in Section 13405. That's Section 13405 of Subtitle D. So if you're Googling or you want to go do your own research, you can just go HIPAA HITECH Section 13405 of Subtitle D, and it will pull it up and it will show you all of these provisions. Now, these things are made extremely clear in this act, and yet many providers and facilities to this day, like the two examples I cited at the top of the show, they're still insisting, they're continuing to insist that this is insurance fraud, that if they have a contract with Blue Cross Blue Shield, and you're with Blue Cross Blue Shield, and your doctor's in network with Blue Cross Blue Shield, that they're required to submit claims. And that's simply not true. What also was made extremely clear by HIPAA HITECH was that HIPAA HITECH supersedes any and all contractual agreements between your healthcare providers and your insurance company. Okay? We're going to come back to this point here in just a minute when I have another point to add to this here in a second. The last thing that I want to mention that HIPAA HITECH did is it exponentially increased the penalties that can be levied against healthcare providers or any person or any entity that violates a person's HIPAA rights and HIPAA protections under HIPAA HITECH. Previously, fines of up to $25,000 maximum could be levied against any entity that violated a person's HIPAA protections. But now, under HIPAA HITECH, the fines have been tiered, and I'll tell you a little bit about the tiering here in a second, but fines could reach as much as $1.5 million, okay, just for a single HIPAA violation. Now, I mentioned that they're tiered, and a lot of this tiering has to do with the intent and the knowledge of the person that violates the HIPAA reg. And so here's an example. The heaviest penalty, the highest penalty assessed, would be to an entity that knowingly violated a person's HIPAA rights and didn't correct it within 30 days. That's the worst type of, but if somebody just unwittingly or unknowingly, it's still a violation. It's just not as severe of a violation if it's done out of ignorance or an unwittingness. But the heaviest fines are levied for organizations and entities that knowingly violate people's HIPAA rights, okay? So, if there are any providers out there, any doctors, any pharmacists, any healthcare providers, any hospital groups, it doesn't matter. If you're out there listening, understand this. Patients have a right to opt out of using their health insurance if they so choose. And this right was established under the privacy rules that are now embedded within this HIPAA HITECH Act of 2013. Okay? Now, of course, this isn't where it all ends. There's a whole lot of other information in here, and you may be asking, is there a caveat? Is there a yeah, but? There is. So listen up, folks. Listen real carefully. Yes, HIPAA HITECH did establish the ability for people to opt out of using their health insurance and do things like pay cash. But here's the caveat for the patient, okay? The caveat is this. If you opt out of using your health insurance, you must pay that provider in full, okay? So no payment arrangements, no financing programs, no payment plans, nothing like that. That provider or that facility must be paid in full, okay? That's the caveat for the patient. So I'm going to use an example real quick, and something that comes up very, very frequently. We see this crop up is with non-emergent diagnostic imaging services. So think about things like MRIs, CT scans, mammograms, things like that. It is not an uncommon thing for us to find that cash prices for things like MRIs and CT scans are far less than the contractual amounts that people have to pay in using their health insurance. I have seen some contracted rates with commercial health plans that paid out $4,000 for an MRI, and the same provider charges $400 cash pay. That is not an exaggeration. That is a true representation. Not every facility is that way, but I have seen variants of 10x in this space. So why on earth would a person want to pay $4,000? Let's say you're on a high deductible health plan. Well, if you're using your insurance and you've got a $5,000 deductible and you file it through insurance, you're about to drop $4,000 on an MRI. Well, why on earth would you do that when you could pay $400 and not file it through your insurance? And it's for things like this. This is precisely some of the issues that were being addressed by HIPAA HITECH and why the federal government put these protections in place. But just remember this, folks. If you opt out of insurance and you want to pay cash, like for that MRI to get it at $400, you got to pay them $400. You can't make payments on it. You can't pay it out over time. You got to pay that bill in full. Now that's one example. And there are literally dozens and dozens of examples that I can give you from experience in my own career where we've seen that the cash price is cheaper for the patient than to utilize their insurance. Another big example of this is GoodRx. By now, if you haven't heard of GoodRx, I don't know where you're living, but GoodRx is a common household name these days. But if you don't know what GoodRx is, it's the shopping tool where you can go online or you can download their mobile app. It's a free mobile app, and you can plug in your prescription drugs or any prescription drug, and it will show you the price at Walgreens versus CVS versus United Supermarkets versus Walmart and Sam's Club, Costco, whatever. And you will see that oftentimes the price variance from pharmacy to pharmacy can be very, very wide. But understand this, people, when you use GoodRx, that is not funneling as a claim through your health insurance. That pharmacy is allowing you to pay them with a coupon, which is a cash pay deal, and it's not funneled through your insurance. And pharmacies have become very used to this and very accustomed to patients may use GoodRx for one prescription and they might file through their insurance on another medication. It really is trying to get to the lowest net cost for the patient, and pharmacies are very, very used to this. However, some providers, maybe they're unaware of this federal law. Maybe they want to just file it with your insurance because they're going to get paid $4,000 versus $400. Whatever the reason is, people need to be educated and they need to be armed with information. Also, another key thing to take into consideration here, HIPAA HITECH does not apply. I'll repeat that. It does not apply to Medicare patients, okay? So if you're 65 or maybe just on Medicare, maybe you're on Medicare prior to 65 for a disability or something like that, but if you're on Medicare, don't go into your doctor's office saying, I demand to know the cash price because I can opt out. I heard it on a Snowball's Chance in Healthcare. Listen, HIPAA HITECH it pertains to commercially insured patients, okay? There's different rules for Medicare, and providers are required to submit claims. If you're covered on Medicare, providers are still required by federal law and regulation to submit those claims to the federal government, okay, and to Medicare. So HIPAA HITECH does not apply to Medicare patients. Keep that in mind, okay? Now I want to shift just a second. I want to shift a little of attention and back over to the providers, the doctors and facilities, and talk to them directly for just a minute. So as a provider, it's clear that you cannot ask or require that a patient opt in or opt out of using their health insurance, okay? That's established. But you should be in a position, you should put yourself in a position to advise them accurately and correctly. And that includes offering them different payment options at your practice or your facility. But just remember, if a patient chooses to opt out, then that's their right, but they must pay you in full. That's a very, very key thing there. It's also very important to remind doctors and facilities that it's critical that claims are not submitted to their insurance carrier when a patient is opting out. Because if you doing so, it would be disclosing PHI to their insurance company, and that is considered a breach of HIPAA compliance under HIPAA HITECH, okay? Now this, if you do that and you breach HIPAA, okay, that could subject you to substantial penalties. I mentioned earlier that if it's a knowing violation, it could be as high as a $1.5 million penalty, okay? So if the patient chooses to opt out, a best practice would be to get the patient to sign a document, some form that you produce at your practice or at your facility that documents that the patient has opted out of having their PHI forwarded to their insurance company. Okay? So we'll come back to that here in a second. But let's also pivot and talk about those payer contracts, okay? Because not everybody says it's an insurance fraud. Another very common thing that providers tell patients is that they would be violating a contract with Blue Cross Blue Shield or Cigna or Aetna or Humana if they don't file their insurance claims. And that may be true because many of those contracts that they have, that your doctors and facilities have with your insurance carriers, still contain language that says that the provider is required to file claims and disclose all health information on that insured patient for the purposes of filing and paying claims, okay? However, HIPAA HITECH changed that, okay? And because HITECH prevents the providers from filing a claim, because you can't file a claim without violating the federal law, without sharing PHI, which is a violation of federal law. Okay, so additionally, here's what you need to know. Contractual agreements that require doctors and facilities to violate a federal law are unenforceable contracts, okay? So HIPAA HITECH supersedes any contractual agreement that your doctors and hospitals have with your insurance companies, okay? Because if they violate your HIPAA rights, that's a federal law that they violated, and no contract can compel your doctors and facilities to violate a federal law. If it does, then it's an unenforceable contract, okay? So my last tip to providers and facilities would be that there's all kinds of templates online for cash pay templates or insurance opt-out templates that we encourage oftentimes when we have to call facilities and doctors' offices to say, hey, look, you can't do this. This patient's wanting to pay cash. We always offer them up these templates that are available online so that they can properly document these opt-out scenarios. Now, there's six there's 6 rights that were established under HIPAA HITECH, and I'm going to rattle them off for you really quickly as we wind down here. Number 1, HIPAA HITECH established your right to ask to see and get a copy of your own health records. Number 2, it established the right to have corrections made or information added to your health information and to your medical records. Okay. Number 3, it established the right to receive a notice that tells you how your health information may be used and shared. Number 4, here's the big one. It established the right for you to decide if you want to give your permission before your health information can be used or shared for certain purposes, including marketing and insurance claims payments. This is directly from the language of the HIPAA HITECH, okay? Number 5, it established your right to request that a covered entity restrict how it can use your health information. And number 6, it established the right for you to get a report on when and why your health information was shared for certain purposes. Okay? So knowing how your health information is protected under federal law, that's the key, folks. That's the key to understanding why and how you can opt out of using your insurance and pay cash when it makes sense to pay cash. So don't be misinformed. Don't be misled. If any provider that you ever go to or any entity ever tells you that if not submitting claims to your insurance is insurance fraud or it violates a contract, understand something. Those providers are violating a federal law, and it's a law that's been well established since 2013, okay? It's not a new law. It's not a new development. It's a long-standing thing, and I just think that a lot of people are unaware of this, okay? But guys, that's what this show is all about. It's about educating people. It's about empowering people, making you guys aware of these sorts of things so that you can protect yourself and you can protect your pocketbooks and you can know, your own rights under these laws. These are resources that can save you money, and they can ensure that you get good access to good, high-quality care at the same time. Okay? So now you folks know. You do not have to use your health insurance if you don't want to, okay? You have the right to opt out and to pay cash. You can opt out of using your insurance. HIPAA HITECH, Google it, research it. That's where your protections are coming from. Well, ladies and gentlemen, that's going to do it for this episode, and I hope it's been helpful. I hope it's been insightful, and I hope you'll join us again next week. I'm really looking forward to next week's episode. I'm going to be chatting with a good friend and colleague on the topic of what should people do if they receive an outrageous medical bill. Imagine getting like a $50,000 medical bill in the mail. what would you do with it? Where do you go? How do you begin to address such a bill? How can it be negotiated down? Or how can it perhaps even be negotiated entirely away? What information do you need to fight outrageous medical bills? Well, next week's guest has written a best-selling book all about how to contest outrageous medical bills. And he's even launched some interactive curriculum for employers to use so that they can educate their employees on what to do if one of their employees ever receives one of these massive medical bills. So you don't want to miss it. It's going to be a great conversation. As always, thank you guys so much for your support. Thank you for listening in each week, where we are arming employers and hardworking American families with strategies, resources, solutions, and tips to give you a snowball's chance in healthcare. God bless. Have a great weekend.